Hi, this is Dr. Mark Sehl for the 65th talk in the YouTube channel, Therapy for the Heart. It's good to be here. It's Tuesday, actually. I'm going to talk about the subject is difficult patient or inadequate methods. So I've been reading some literature on people working with patients who they describe as difficult. I don't like the word difficult. I think it's prejudicial. I think it's a setup. I think if somebody's difficult, we need to learn to adjust to ourselves in terms of what problems we're having with that quote-unquote difficult patient. You know, we're all difficult in our own way. Some people can be easy for others to work with, and the same person could be very hard. And so who's to say who's difficult? Again, a prejudicial categorization. You could have an obsessive person who could drive somebody crazy because of their obsessions, or you could have somebody, and I don't like labels, but borderline, who could drive somebody else crazy with their rapid mood swings, and seeing the therapist as all different kinds of things from one day to the next. People have problems. We all have a little bit of everything in us, and that's what I've said in a lot of these YouTube videos. So, yeah. So I was reading something about selecting patients for treatment, or considering patients for treatment, and this said these characterizations were if the person has a lack of empathy for themselves, an inability to soothe themselves, lack of capacity for insight, doesn't take interpretation. Well, hell, you know, I was thinking about Jane when I read this. I said, well, Jane had all of these things. She had a lack of insight. She thought everybody's problems, her problems didn't exist, that she externalized all her problems to everybody else. She had a lack of empathy for herself and others. She had a little insight until she was in therapy for a while. So that was a case that just didn't stand the criteria of their deciding what a successful person would be in treatment. It's crazy. I remember when I was in training, you know, they would look for a neurotic to be in training as a psychoanalyst, whatever that was, you know. And I was thinking, somebody joked around with me to say, I haven't found a neurotic since I've been working. What is that? I mean, you can look up a definition of it. So these characterizations applied to Jane, but she had everything, and then she worked very successful. You know, the only reason why I was able to be successful, it wasn't because of her, it was because of my determination to understand all the difficulties that I was having working with her. Countertransference, to, as we say, you know, that covers all your feelings that you have about a patient. And so if you want to go back and look at that, you might want to revisit the podcasts on iTunes and put Therapy for the Heart in there, and iTunes or SoundCloud.com, or look for Jane. And there's, through the list of all the videos there, you can find the ones that are related to Jane. They'll say Jane in there somewhere in the title, or From Hate to Love. That's one of them. Yeah, so it's a good example. But it was very successful treatment. But you know, she stayed with me for a long time. She had a lot of disturbances in her, being attacked and criticized, and told she was nothing, and she didn't know of anything. She didn't know anything by her mom, and her father stepped out, and he really made it difficult for her to have a good relationship in life, because you need a father. You need a father to pull you away from the symbiotic pull that the mother has for the child. And also, you need a father to be able to function better intellectually. Studies found. So anyway, she didn't have a father really there. He was interested in her sexually, partially, and also absent. So, but she had all of these things. You know, people have problems. The minute you put them in a category, someone just wrote me on one of the social media sites, and she said, well, I haven't had too much success because I'm borderline and therapists avoided me. Not all. That was hopeful. So yeah, so not all, and that was good. So that's what happens though when we set somebody up with a diagnosis, borderline, narcissistic personality disorder is another one. You know how much hate the people who have this disorder. I mean, everyone has a narcissistic disturbance of one form or another, in my opinion. You know, what do people get up and give all these long talks for on TED Talks and psychoanalytic conferences? They're up there to get their word out. You know, it's healthy narcissism. And some are effective and some aren't. Some will talk theory all the time, and some are very down to earth and talk about cases, and you know. But it's all, you know, somehow some part of self wants to shine, you know, and be out there and get appreciation. The only trouble with narcissism is if you don't know that you have it, and most people often don't, and you walk into a room, and you might take up a conversation and dominate the whole thing, and then you wonder why everybody leaves because nobody wants to listen. You know, why should they? You're not just talking about yourself. But the anger, I mean, I've been on Psychology Network on LinkedIn, and people talk about narcissism with such bitterness. You know, sure, narcissistic people can be very, very misunderstanding, not understanding of anybody else's needs, but they have problems. And they have problems, they weren't born that way. I mean, why would people get so angry at them? Would they get angry at an obsessive compulsive because the obsessive compulsive is driving his wife away because he wants to keep so much order that he gets furious with anything that's out of order, or washes his hands 30 times a day and disturbs everybody with that kind of behavior, you know? I'll read you something that I read something about narcissistic personality disorder. One of the most important presenting symptoms of the narcissistic in therapy is his or her insistence that he or she is equal to the psychotherapist in knowledge and experience or in social status. How dare he or she? The narcissist is in the therapeutic session spices his speech with psychiatric lingo and professional terms. Right? Shame, shame. Why should that bother anybody? I'd ask the therapist, what bothers you about that? What needs isn't being met by you that you dislike this person or has such what to me is an antagonism towards these people? But they have them, you know? Sure, narcissistic people are very self-involved, and aren't we all somewhere or another? And it's a good, healthy. Kohut came along and he wrote about the level of development of narcissism, and he made it acceptable, and he took the pejorative away from narcissism. He wrote a lot about it. He wrote a book about it. Heinz Kohut. So I hope we don't judge people in general or because they have problems. So that's what I'm talking about today, about treating the difficult patient, quote unquote. Scrap, delete, difficult. So people have ways of setting people up, and then other people can be turned off and anxious about the difficult patient, as if you're not going to be able to treat them, especially if people are in training and they're beginning training. I learned the most of my professional life with the most hard to reach patients because they brought out that part in me. Anything that you're going to have difficulty with is going to be a feature presentation to investigate in your own psyche. That's what it is. It's the feature presentation. You forget about everything else for a while. The minute you have a disturbance about somebody who you're going to see or are seeing, and you're having a problem with it, that's your problem. Now, there is something about objective reality. So if a therapist has a very attacking patient, right? So you have objective hate for that person who is up and down, ridiculing you, telling you, like Jane, she did with me. She said, "What do you know? What do you know?" But I didn't attack her back. I had to know that it was also a transference going on, but also something that I was doing in the therapy that was trying to get her, help her to talk to me, but that the very thing that I was trying to help her do, she was frightened of, because she had a merger factor going on with her mother, and her mother wanted to merge with her and be so close, and that frightened her. You know? So I had to work on that. I worked on hard myself, and but you don't just disregard people like this. The narcissistic in therapeutic session spices his speech with psychiatric lingo and professional terms. So what? Deal with it. Sometimes if somebody says to you, you don't want to do this early on in stage, but I think sometimes you can say, if somebody says, "I'm smarter than you," you don't want to let yourself be run over by patients. You know, somebody with a very high critical field that he does, and there's a lot of criticism and evaluation. Maybe in the finance or the stock market. He comes in and he sees you, and you're very, you look young, right? Maybe you just got off the boat from China and you're in your first session. Whatever it is, we do work with people and supervise them in China and supervise in psychoanalysis. Just kidding around, but anyway, supposing you did, so you were that. So he says, "So what's your experience?" And you ask him, why do you want to know? What is it you want to know about my experience? Well, you look very young. I don't see how you could be that intelligent and have that much experience in terms of your intelligence. And well, what's intelligence got to do with the youth, right? But you can say, well, what's intelligence have to do with youth? And then if he or she keeps on, you could say, well, listen, you might be more intelligent than I am, but I'm emotionally smarter than you. You put that one in your belt if you're training. Just have that ready. You have to have things ready, because people are going to walk in and we're not going to be so nice sometimes. Most patients, when they come in, are not that obnoxious, but they could be. So one of the things that you can learn is to, if you're a new beginning therapist, is to, what can you have as a comeback, in case somebody's going to say something to you and you're going to be uncomfortable about it. It's very good to know those things. Learn them, memorize them. But most patients are not like that when they come in. They're scared. They're frightened that you're going to judge them. If they say something, you might throw them out of the office. They haven't had a history of secure attachments in their life. Secure attachments are, really telling in terms of how someone is going to do in life. We've talked about that a lot, but I just spoke to somebody, and this person came to me from another country, and because she was so ashamed of what happened to her with her therapist, so she couldn't tolerate being seen by any in the same country. She was frightened, and she's done so well. We were talking about abuse and things like that. She's done more, but she had no secure attachments. She was. I'm not going to go to detail, but it was very, very. She was like forgotten about, not paid attention to. Very damaging. She's done very well. Done very well. Another example of somebody who those people would say not fit for good psychoanalytic work, right? A lot of anxiety, but she did have some self-reflection. But she's done very well. So, think of anything else. So as far as techniques, and you don't want to rely on interpretation, because those methods, at least I threw them out a long time ago. Interpretation is all right if you're working with somebody for a while in treatment. And I think the best thing to do with prepare for interpretation is wait for the patient to ask you. If you could give them an interpretation, let them ask you. That means they're ready. Most of them don't want interpretations. That makes people feel little and small, and you're the wise person. We're often not that wise anyway. We're wise, but we're not. We are wise, but often we're over-idealized, and we need to be prepared to have that idealization um, um, attacked sometimes. So that's what you have to be prepared for too, because people want to set us up on a pedestal and then knock us down just like they were knocked down, or like their parents were on a pedestal and they came down too fast. They had immense problems, really severe problems, and when that happens, the child becomes very identified with that, and they look at the parents and they're falling or down all over the place and making all sorts of mistakes, and their strength gets weakened too, because if you don't have a strong figure that's going to lead you in life and care for you, it's very, very disruptive. So interpretations is out, and just listening. Listening is so important. Paying attention. Attention means listening and taking your mind off of everything, all your theoretical formulations, and not fitting the patient in with any formula. Just evolve. Watch that person evolve. And listening feeds the person being listened to. You might be the first person, if you're a therapist out there listening, or if you're somebody who's having trouble with a marital conflict. Are you listening and paying attention? Paying attention is so heartfelt, so the other person, it resonates if you're listening. Most people often can't wait for a chance to get into their own version of whatever story you're bringing up. Oh, by the way, that reminds me of, I had a patient, his mother did that all the time. Oh, by the way, that reminds me of. He never got to tell his story of his life because everything reminded his mother of something, so his mother took over and he had no place. So it's listening, it's patience. So important in communication and relationships, patience, and letting somebody have their difficulties and faults, and not being critical, not judgmental, accepting. It's hard to do, but it's wonderful when you can find a relationship somebody has that for you. Acceptance, non-judgmental, and listening and paying attention. So that's all I'm going to say for now. This is Dr. Mark Sehl for the YouTube channel Therapy for the Heart. And please like the talk if you do. There's a button you can push and like it. And if you want to write me an email, you can, marksehl@gmail.com, and also my website. You can visit it at marksehl.com. So thanks a lot. This is Tuesday, signing off for now. Thanks a lot for listening. Bye.